Hi, I'm Annie Naylor. Good afternoon. And I am from the Arizona Myotherapy Center in Scottsdale. You can reach me at arizonacenterformuscletherapy.com. Is that, I'm correct on that, aren't I? I always get my websites mixed up. And you can go to my YouTube page where you can see some of my YouTube videos that I talk about different issues that we're dealing with as far as what we see in the clinic, and I'm also on Facebook and LinkedIn. And today I am with actually one of my designers. This is Erica, and Erica is a graphic designer. She is a photographer. She started seeing me because she started talking to me about headaches that she was having. We sort of kind of just fell into it with her working on the computer one day, and she was telling me she was having a bad headache. And so we started kind of delving into her history, and to find out that Erica has had quite a lengthy history of headaches for a number of years. She is 24 now, and so she has been suffering almost on a daily basis. Yeah.
Since childhood, so it's been a regular weekly, if not daily, occurrence for me.
It has. So this was an issue that we wanted to get under control pretty quickly, and so going through some of the tests that I do in the initial treatment, checking for scoliosis, checking for muscular scoliosis, checking for forward head cage. Is she leaning too far forward? Where are her stressors holding? Is there issues in the low back that are contributing to her neck issues? And we found actually multiple sites for her, because when you're dealing with something that Erica has been dealing with for a number of years, it's what I call there are several drivers involved. Is it going to be a structural issue? Well, we want to get structure, we want to check it, we want to be able to make sure everything's fine. And through her years of going to doctors, and she was never diagnosed with any structural issues in any way, so we were pretty comfortable at finding out that a lot of her problem was muscular driven, and muscular driven in a lot of areas. She had contributing factors from the low back. She had contributing factors from the gluteal area, from her legs, from her hip flexors, all the way up through her back, neck, and jaw. So one of the things that we did is we started working pretty aggressively with her and giving her a corrective exercise program. This is an important thing about all of you, I like to say millennials out there, but it even goes far above that. I've been now seeing a lot of neck and shoulder problems caused by computer issues for a number of years. When I first started out as a myotherapist, I saw a lot of manual labor problems, low back pain. Now almost all the problems that I see have some sort of involvement of neck. And what is happening is that we're really seeing an increase in headaches and migraines. I think that your situation, you were basically diagnosed with chronic headache pain, but to develop, and have been dealing a lot, I've been dealing a lot with migraine pain, and seeing just the increase. And women suffer migraines 700% more than men do. So it is on the rise, and it's getting really out of control for a lot of people. To have to live on a daily basis with headaches. For some of you out there, you know what I'm talking about. You deal with migraines and headaches on a daily basis, if not several times a week. And so this is something that we really need to get out there and on the forefront of looking at it from a muscular standpoint. A lot of things that I like to do, and if I could have you, Erica, go ahead and lie face down for me on the table. I just want to kind of go over some things that I had found out on an individual basis with Erica, is that she holds a tremendous amount of tension in the gluteal area and in the low back area. This was a big contributor. Also, we want to take a look at that we don't want her sort of developing a condition that is called, it's a kyphotic condition. It's sort of that the upper back starts to round out a little bit more. and we want to keep that from happening, and we also want to protect the cervical spine from straightening out, because it's going into what's called a 3-degree forward head cage. And 3 degrees is a tremendous amount of stress on the cervical spine, posterior cervical muscles. They go through a lot of problems. So working on Erica, she would have a lot of referrals referring up into her head, to her forehead, behind her eyes, and then really realized that a lot was coming from her jaw. A lot of you women out there are clenching an awful lot, and we kind of are thinking which came first, the chicken or the egg kind of thing. Did the person start clenching first due to the pain, or did they start having pain and then starting to clench? But it gets into a very, very nasty pattern that can be a very difficult pattern to break, but it can be broken. So I used to be one for a period of time that clenched and did some grinding, and I fortunately didn't experience headaches from it, but was experiencing a lot of jaw and neck pain from it, and I cleared that situation out quickly for myself when I would see my myotherapist. So we worked with Erica pretty diligently. She now pretty much comes in when she has a treatment, and I'll say to her, so how are your headaches doing? And she goes, they're great, I don't have them. So it's kind of nice. She's basically getting through her week with no headaches. So that's a big one for us. I'd like her to come on up onto her hands and knees for me, if you could, Erica. Again, as we're dealing with our patients, there is always a corrective exercise component that is involved in helping reteach muscle function. And so cat back is a favorite of mine, because it takes out the cervical spine, it flattens it out, and it takes out the lumbar spine. And then we can drop the back down while we lift the head up, and we can bring the curvatures back in again. So the muscle starts to learn this function. And so corrective exercises, as you can see, she has a really nice, smooth, nice straight back. And so we're going to take her through these movements, and these are movements that she's learned to do on a daily basis. And so that's going to be important. I'd like her to also sit up with her legs off to this side. A couple of the other corrective exercises that these girls are needing to learn how to do is doing what we call shoulder rotation. So we're going to bring the shoulders forward, and then we're going to bring the shoulders back. And it's very, very important, because it's teaching contraction, extension. It's teaching extension, contraction. Okay? And the muscle will start understanding that function when you start giving it to it. And so these areas will start, their stress will start coming out of this area. The muscles will understand their range of motion that they need to go through. And so this is going to become a pattern, because you're going to be sitting at a computer 15, 18 hours. These girls are telling me that they're sitting behind computers, and maybe even longer than that. And so we have to, while we're teaching dysfunction to muscle, which is what we're doing, to start teaching function to muscle. One of the interesting things that I was teaching a graphic design studio in San Francisco years ago was the owner and I were talking about making stand-up stations for his designers, and kneeling stations, and sitting on a ball if they wanted to roll around on the ball while they were working on their computer. But that they can change their different levels. They can go from seated, they can go to kneeling, they can go from standing. And I've seen just recently a commercial out for, I think it's called Visio-Deck, and it's a desk. And they can lift that desk right up, and the person can stand up at their workstation. Brilliant. I should have thought about it many, many years ago. I was telling people 25 more years ago to start doing that, to stand up at their workstations. And so posturing is going to be really important. People are getting stuck in a seated position. That's not where you want to be. You've got to get up and you've got to move around. You've got to be able to keep all of this wanting to do the job that you're giving it to do. Another thing that I'm seeing also with a lot of these computer workers is that their shoulders go into forward rotation. So that when they're standing there and they're talking to me, and I can kind of mimic it a little bit, they'll stand and they'll be talking to me like this. Their hands are in front of them. And the hands are meant to be at your side. They're not meant to be in front. So people should check themselves at something like that. I also do kinesio taping, so I may tape somebody's shoulders back for a couple of weeks while I'm working on getting them out of that forward rotation, because that's still, you could get the headache out, you could get the neck feeling better, but if you're still in forward rotation with those shoulders, tight in that pec muscle, and also very tight in the axilla, okay? So we want to see this opening up a lot more, and so that's going to be some of the movements that are going to be taught to a lot of people that are computer workers, that, you know, they've got to get this area very opened up and open up this area and able to let the shoulders sit where they're supposed to sit and take the stress off of the retractors in the back. So, and then everything likes to sort of, then what happens is the pelvis is going to start sitting under you properly. You know, when you go into, if you go into a forward head cage, so I'm going to have her, and so she drops her head forward, and what happens is her lumbar spine comes out, it straightens, her shoulders go into forward rotation, and she's dropped her head. And now she looks like this instead of looking like this. And all I have to do is take that neck back just 3 degrees, okay, and I've given myself my lumbar spine, I've given myself my cervical spine, and I've gotten my shoulders back. But how do they stay there if the pecs are so tight? You need to continue to do what I talk to everybody about is doorway stretching, and stretching your shoulders out, particularly in this position. You want always to have your arm behind your ear. I see people like this. How far can you take your arm back? To about here. I don't want to see the armpit. That means they're really being pulled. They're being really locked down here. And that's also going to be a contributor to carpal tunnel too. So we want to be able to get range of motion. So, so with that, I want to finish up and say that Erica's doing really well, and that thank you for joining us this afternoon.